Hello, I'm Anita, and this is Care Experts, brought to you by CareCredit. With the CareCredit credit card, you can get the dental work you want or need now. CareCredit is accepted at hundreds of thousands of locations nationwide for preventative, restorative, and cosmetic dentistry. Today we're in Los Angeles, California with Dr. Daniel Naysan. Dr. Naysan is a member of the American Dental Association and specializes in aesthetic smile design. He practices cosmetic, general, and emergency dentistry in the heart of Beverly Hills. Today we're talking about veneers. Thank you so much, Dr. Naysan, for joining us today.
Thank you. Thank you for having me.
So first of all, I understand that you specialize in veneers.
Yes, I primarily focus my practice on smile makeovers with porcelain veneers.
So tell me exactly what that means. I know you specialize in aesthetic smile design and veneers. So what exactly are veneers and what is it that you do?
So veneers is like a thin contact lens that covers the front part of your tooth. What you can accomplish with that is you can change the shape of the tooth, change the shade color of the tooth, and even change the position of your teeth. So your overall can change the aesthetics, the look of that person's smile, and their overall face.
So why and when would someone need veneers?
So you're talking about cases where people have like permanent staining. There's a birth defect. It's something where you get something called tetracycline staining through antibiotics, where your teeth will never get white through any type of whitening products. So veneers would be a great option for that. You're talking about damaged teeth, old restorations that have failed, such as composite resins. Talking about people that are just not happy with their shape of their teeth, that they can't do anything to that except with the porcelain.
So even if you didn't have maybe one of those issues that you just mentioned, but you just were unhappy or unsatisfied with your smile, you could still opt for veneers.
Correct, yes.
And can you get one veneer or do you need a full set?
I mean, usually it's better for the overall aesthetics, for everything to flow nice, to do at least the top 10. But in cases where people don't want to, you could get it away with doing one, but there are limitations because over time your teeth will change color, but that porcelain will always stay the same. So you got to make sure that the dentist is using a great qualified ceramist that knows how to blend and make that porcelain to match the rest of those teeth.
And explain to me exactly what veneers are made of.
So there's two types of materials mainly. There's porcelain, and there's different types of techniques of how you can make the porcelain, and there's resin composite veneers.
Can you just explain to me what the difference between those two are that you just mentioned?
Yes, with porcelain, you can get more value. When you take a look at it, it does look a little bit more natural. You can play with the color a little bit more. Something to mimic nature, whereas composite sometimes looks over time, gets a little bit matte, it can stain, and they don't last as long as the porcelain.
How and when do you know what to recommend to each patient?
We usually opt primarily to do the porcelain because you get a way better outcome with it. It lasts a lot longer. Patients are usually a lot more happier with the porcelain than they are with the composites.
Can you walk me through what a typical procedure is like and from start to finish, kind of what is the first step? Do you have to shave the teeth and what a patient could expect if they're going into this?
It's a great and very interesting question. It's a process where you start with a design. So a person comes in and you go over their concerns. And off of what they're trying to accomplish, you start with a design.
Okay.
You do this outside of the mouth. So we can do it digitally and we can actually do it on a model. And so after we complete the design, we get the patient back in, and depending on where the tooth is in the alignment, we shape their teeth as minimally as possible and make temporaries that match that design. So remember, the porcelain is only half a millimeter thick. So if you're broadening out the smile or adding more volume, you really don't need to remove any of the tooth structure.
Yeah.
So patients wear those temporary, and there's a new look, it's a new design. It's actually really life-changing when they start to see, wow, look how I look in the form of temporaries.
Yeah.
But we don't commit it to that. We don't commit to that. We have that patient kind of test drive that smile and wear it for a few days. And they come back and give us the feedback on what they like and what they don't like. And during that visit, we finalize the design. And so we want that smile to blend in with that person's facial features. We don't want to see teeth first. We want it to just look like it belongs. So once we're happy, the patient and I, then we start making the actual porcelain. So that's when the ceramist comes into play. That's the one that's actually making the porcelain, making it beautiful, making it look lifelike. That process usually takes about 2 to 3 weeks.
Okay.
Patient comes back, we remove the temporaries, and we put the permanent ones in, and then we're done.
So this is a process that could take probably maybe a couple months from start to finish, just depending on how many times you have to change the design and how long it takes for you and the patient to come up with a design and a look that they're comfortable with.
It usually never takes more than a month.
Okay. I find it so fascinating that with all this technology and just like the knowledge that you have, that you can literally design a smile that could change someone's life.
It's really truly incredible.
Are veneers permanent? So if someone opts to do that, is this just something that they have for the rest of their life?
They are. If they're done properly, if that person does take good care of their teeth, has good hygiene, if they are someone that's clenching or grinding teeth, they'll need a night guard, but it could last a lifetime. The literature, though, does support about 20 to 25 years.
And on average, what have you seen? Like, how long have they lasted for you?
I mean, the case is, a person is good about taking care of their teeth. I really believe that they could last a lifetime.
Wow. And are there any specific downsides or complications that you would tell patients before getting these procedures?
In very rare instances, some patients can get some type of sensitivity, but most of the time it's reversible.
And could you still get cavities, tooth decays, tooth staining? Are all these common with veneers?
So as you recall, the veneer only covers the front part of the tooth. So everything around and behind the tooth is your actual tooth. So if you're having like lots of sweets, you're having lollipops, you can still get those cavities behind the veneers, although it's not really common.
But with staining, is that going to help prevent it since you have the veneer?
Correct. So you do not get the staining
Okay.
with the porcelain.
So that's definitely an upside to the veneers.
Yes.
And how much in general do veneers generally cost?
So it really depends on who you go and where you live, but it's usually around $2,000 to $3,500 per tooth.
And I know we talked about how, veneers may be something that you're opting to do cosmetically. So I'm not sure if insurance covers something like this. And if it doesn't, or if there's, patients that don't have insurance, what kind of financing options do you recommend to your patients?
Yeah, unfortunately, it's not covered by insurance because it's considered a cosmetic procedure. So yeah, in instances that when the insurance obviously can't cover it, there's third-party financing companies such as CareCredit, and patient pays it over a period of time instead of incurring that expense upfront at once.
Yeah, it sounds like the CareCredit credit card is the perfect option if you're opting for something like veneers, because this really is a lifetime investment for you.
Big time, yes.
Well, thank you so much for your knowledge on veneers. And I know you're so passionate about this topic and working with patients. And I'm curious to know, why did you choose to become a dentist?
My father's a dentist, and I grew up watching him work, and really it started with the relationships, but next it went on, evolved to being able to change people's lives and give them confidence with their smiles and feel really good about themselves. And that's really been a blessing for me.
Well, I can see the passion when you speak about it, so I'm sure your patients are thrilled with your work.
Thank you.
Thank you so much for joining us today.
Thanks.
Thanks for watching. All of our featured care experts recommend and accept the CareCredit credit card, which is accepted at hundreds of thousands of provider locations nationwide. For more information, visit carecredit.com.
Thanks for joining us on Care Experts with CareCredit. If you enjoyed this episode, please subscribe and share with friends and family. And stay tuned for new episodes every week. Purchases with the CareCredit credit card are subject to credit approval. Minimum monthly payments required. See carecredit.com for details. This content is subject to change without notice and offered for informational use only. You are urged to consult with your individual medical providers with respect to the information presented. Synchrony and any of its affiliates, including CareCredit, collectively Synchrony, makes no representations or warranties regarding this content and accepts no liability for any loss or harm arising from the use of the information provided. Your participation in this presentation constitutes your acceptance of these terms and conditions.